Good morning, everybody. Welcome. I'm going to go ahead and get started, and we're recording this, as you could hear. That way, in case people weren't able to make it, they will be able to share this later. So welcome to my presentation, guys. I am super duper not formal in any way, shape, or form. So I'm just going to kind of get started on the program. I've been working with IHFRA for a couple of years now, and I'm super excited that Steve and Bonnie and Ray let me be a part of you guys, this amazing team. As when we first got started with IHFRA, it was more on an individual basis to see kind of what we could do for you guys. But then after we kind of got to know you a little bit better, had the opportunity to understand kind of more of the association membership needs, I went back and started searching for carriers to find us group plans literally for you guys that are reps. And so these are considered a group product. So that means, and this is the most important thing, that means that it's guaranteed issue. No matter where you are in the country, all 50 states are covered. You have PPO access in all 50 states, and we'll talk about that in a minute. But the most important thing I want you guys to hear today and to hear from me today is specifically it's guaranteed issue. I don't care how sick you are. I don't care what you got going on. We can add you, and as long as we add you by the 15th of any given month, you'll have coverage by the 1st of the month. So that's kind of our deadline for enrollments. If you can do it all year long. Now, if you are in a group product with an employer, like if your spouse has something, et cetera, and you're on that plan, you may have to wait on their side for open enrollment to get off of that plan. However, on my side, anytime you want to enroll, again, we just enroll by the 15th and you'll have coverage by the 1st of the month. So I wanted to make sure that we talk really strongly about that, because to me, that's probably one of the most important things that we can talk about. A lot of people are like, well, will they take me with my pre-existing conditions? Pre-existing conditions on this plan do not exist. You were covered day one of the effective date. So if we sign anybody up today, they're going to have coverage June 1 with no pre-existing condition and no pre-existing condition waiting periods or exclusions. So let's kind of get started. If I'm smart enough to learn how to use this little fancy way. The next slide, sorry guys. What we're going to do is I'm going to jump back and forth between my PowerPoint and the web, because what we started is we started doing something that we would be able to commingle with some existing benefits you had. And so this allows us to not only have our primary needs of, health, vision, and dental, but also to have some additional ancillary products through Colonial Life. And we've tied all this together so that you get access to them together. So bear with me as I kind of jump in and out of all of this. Now, this, guys, is this is considered Colonial Life's landing page. This allows us to be able to just do stuff specifically for IHFRA. We have our own dedicated benefits counselor there. You always have me and you always have my team, but we have dedicated people specifically for IHFRA. So if you ever call, you're not calling and dealing with 5,000 different people. We have one contact, and that's Gabriel, and we'll talk about that in just a moment. But this is kind of what your page looks like. And if you notice, it says your benefits learning experience. That's one of the reasons I chose to bring in Colonial Life with this product, because they do have a lot of education on surrounding why would you want any particular coverage. Because a lot of people, well, most of you guys are probably not insurance people. So, they make all of the words as difficult as possible. Okay, let's just say that. And they don't want you to understand what you have. And so it's my job, and anyone who is ever an agent for you, it's our job to educate you properly on what it is that you are buying, what your risks are, where you have, where you have some holes in your coverage. And that's why we've kind of brought all this together, because this will allow us to talk about all of those things. So this website you can get directly from your IHFRA membership portal. So you can get to that. You don't have to take down this note or figure out what this link is. Don't bother, because Steve and Bonnie already have it on your webpage as members. So you can go straight to, health benefits, and you'll be able to click on here. And I want you to kind of see some things, and I'm not going to play this video specifically, but this is like education. You can come on here, you can see education, and to see what Colonial Life adds to just a standard health insurance product. Keep in mind, health insurance is going to pay bills that have to do with health. They're not going to pay your other bills. Okay. It's also not going to pay your copays. You always have to, have some, teeth in the game. So that's why we talk about ancillary products. And so not only do we have ancillary, but we also obviously have core. And so core benefits is going to be medical insurance. And we're going to talk about that in just a moment when we jump to the different section. But we can get medical insurance and guaranteed life insurance, guys. So if you have guaranteed life insurance, that means that you can go get final expense or something if you need it. So make sure if this is something that you're looking for, that you go in, you can schedule it with me. You can also schedule directly with, if we clicked on life insurance, it's going to tell you, but we can schedule directly with the right people. And I'll show that in just a moment. Voluntary benefits, and here we go. So accident, cancer, critical illness. This cancer is going to be a big thing that we're going to cover in just a moment, but we can get these added as ancillaries. And again, videos to tell you, why do you need this kind of coverage? It's to help with your out-of-pocket expenses and to help if you have, some big thing come up. And let me give you an example. My husband had open heart surgery last year, and we had our health insurance, and then we had an ancillary. So we were able to bring home, I was able to take off work for 2 months because I could let my team handle the things and I didn't have to worry about anything because I knew I had income coming in from one of my standalone policies. So my husband ended up getting $57,000 on his health needs. And because of that, it was able to allow me to take some time off. We were still able to pay our bills. We were able to pay our out-of-pocket expenses and have a little bit left. So guess what? He had to retire after that. He couldn't work anymore. But let me tell you, I could not be more thankful for having ancillary products added to my health insurance, because they'll never make money off of me, obviously, after getting $57,000, but I will never cancel my policy either. So, it just helps because you never know when the big things are going to come up, right? And so when those big things do come up, if you knew in the back of your mind, oh my gosh, I have something there, fantastic. So in that case, that's what these are for, and that's what Colonial Life is for. So Get Connected is the next piece. This is a very basic website, guys. You can, you get me. And then of course, Gabriel is your ancillary benefits specialist. Now, ancillary usually includes vision and dental, but I've got Delta Dental and VSP on our program. So you don't need to get that through Colonial Life. We'll do that specifically for, we'll do it directly with VSP and Delta through your own custom stuff, but everything else is going to be fantastic for you guys to go through. So let's jump back over here. We're going to talk about now the health plan. Our health plan, guys, is custom specifically for you. And please tell me, can you see my screen? Just I'm going to say that you can. I haven't heard anyone say you can't. So, okay. So this plan has, multiple components. It's traditional and coverage. So if you've ever got a quote from me in the past and it wasn't a traditional plan, get back to me, okay? And here's why. Because again, we added this additional benefit for IHFRA, and we did a lot of work to make sure that we're covered from a legal standpoint. It's ACA compliant. So if they ever do initiate the individual mandate fee back into play, you're still covered and you don't have to worry about it. It also has a deductible, and it has co-pays instead of co-insurance. So what does co-insurance mean, guys? Remember back in the old days when insurance used to actually have some kind of benefit. Don't get me wrong, there's a place for it, but there used to be, you used to have like a deductible, and then you would have 80-20, which is 80% the insurance company pays and 20% that you pay, and then you'd have an out-of-pocket max. Well, on this plan, and we're going to talk about that, it has a $5,000 deductible across the board on the two higher plans, $5,000 deductible, $10,000. I'm sorry, it has no deductible. Oh my gosh, I'm gonna have to edit that out. Has no deductible with a $5,000 max out of pocket or a $10,000 max out of pocket. Now the basic plan has a higher deductible and higher out of pocket max, and it has some higher copays and a little bit more limits. But guys, if you're healthy and you don't go to the doctor much and you just want to have something, I only go to the doctor a couple times a year. I want to make sure I have something happens to me. Guys, the basic is going to be just fine for you. So, again, we can come in, we can put all these things together, we can customize, we can pick what level's best for you, and then we can decide if an ancillary product is right for you. You don't have to go through Colonial first and then come to me. I will help you get all of that situated, and we can decide what's going to be the best plan for you. But these prices are across the board, the same price, no matter how old you are, no matter where you live in the country. So these are flat prices. And yes, I'm going to answer this question right now. Yes, this is less than you can get this product on the market. Okay. I went directly to a carrier specifically on behalf of IHFRA. These are IHFRA's prices. You cannot have these prices if you're not part of the association. Okay. So it's more expensive, obviously, in the overall market. But for us, we have our own dedicated people at the insurance company, because I did work really hard on getting these programs for you. Now, they do have some limits, and I want you to make sure you understand it. The limits are the number of doctors and specialists you can go to. Those are per person per year. I mean, this is 24 doctor's visits per person per year. If you go to the premium plan, that's 2 doctor visits a month. Even my husband, who's sick as a dog with his heart, he doesn't go that often. So that's, if you're comfortable with that, if you're not comfortable with that, guess what? We've got other plans. But I have not ever had anybody that's like, I got 0 deductible and I just have to pay copays. Yes, that's exactly how this plan is. So how do you hit your out-of-pocket max on these plans? By copays. There is no coinsurance. Like I said, that 80-20 that it used to be, or maybe even the plan that you have now, very seldom are they 80-20 anymore. They're usually 70-30, 60-40, and the bronze plans now are 50-50, which is stupid. But this is 0. What's going to hit your out-of-pocket max? All of your copays. Okay, so if you have copays to go to the doctor, that $15 every time you go, that's going towards your $5,000. $350 copay for a CT scan, that's going to go towards your $5,000. And then, telemedicine obviously comes free of charge. You can use them as much as you want to. This does have prescription drug coverage. If you take a drug that has a commercial on TV, this is not going to be the right plan for you. If you take a drug that has a commercial on TV, Ozempic, all of the ones that you've got all of the celebrities pushing, they got to pay for that advertising, guys. And those are usually $10,000 to $20,000, tickets on a retail basis. So if that's the kind of drug you take, you need to stay on your major medical marketplace, Obamacare, ACA plan that you have, because no matter what plan I put you on, those drugs are always excluded because of the cost. So the only ones that can't exclude those are Obamacare, ACA marketplace. They're all the same thing. So if you ever hear anyone say any of those words, they're all the same. But we do have prescription coverage on these 2. If you don't take anything and you don't have any preferred, non-preferred, again, the basic plan may just be fine to cover you. Hospitalization, again, copays. And I want you guys to see this really importantly. If I go to the doctor, if I go to the hospital, and for instance, my husband has open heart surgery, his copay is $350. That's it. That would, had I had him on this plan, and I didn't, dang it. Had I had him on this plan, because I didn't have it made yet, if I had him on this plan, we would have paid $350, and I would have pocketed all of the additional ancillary products. And that was it. I didn't have to pay for anesthesia. I wouldn't have had to pay for surgery. I wouldn't have had to pay for my hospital stay. It's a $350 copay to go to the hospital. Outpatient surgery, same thing. You need a new shoulder. You need a new knee. You need a new hip, like I got last year. $350. And then emergency room service, $350. If you've ever been to the emergency room, by law, emergency rooms have the legal authority to charge 1,100% up, just because it's called an emergency. I don't care what insurance you have, whether you're with me or you're with somebody else. Stay out of the emergency room for doctor visits. Emergency rooms, they really are making it cost ineffective for you to go there unless you're going to be admitted, or it's a true, like you're bleeding to death, etc. So, if you can try, urgent care or teledoc first, I encourage you to do that from a cost perspective. Again, no matter what insurance you have, but on this plan, at least, if you go to the ER, it's $350 and you're done. Unlike most other carriers that have a $500 fee, and then you pay towards your deductible. So again, you've got a $350 max, I'm done, and that's going to my max out of pocket. And if you'll notice the difference between these plans, guys, it just limits the number of days you can go in the hospital, 5, 7, 10. I've never had anyone be in the hospital longer than 10 days that wasn't due to COVID. And then it's obviously been a very long time since that I've had anyone been in the hospital for that long anyway. Even with my husband, when he had open heart surgery, he had 3 different surgeries over 3 different days. He was in the hospital for 11 days. So I'm sorry, 10 days. He was right on 10 days. Not even, we thought we had to stay the 11th, but on 10 days we were done. So we would have been, again, just fine, 350. So again, any ancillary products that we would add, if you're upset a little, or it kind of just, that bothers me a little bit on a limitation, on those limitations, there, again, ancillary benefits we can add to kind of fill in those holes. If those are things that you want to worry about, because maybe somebody else who's a little younger than you or lives in a different place is like, I don't need that extra coverage. So again, everybody's a little different. There's no one size fits all, but this gives us one size to start and see if this is enough or if we need to add anything different. This does cover home health care. Okay, so if you need home health care, it covers additional surgical opinions, does cover chiropractic. So in addition to all your other visits, you also get some $25 chiropractic visits. All right, you get $250 copay to use an ambulance, and you can see additional coverage for chemical abuse. This is going to be, drinking or narcotics. Now, here we go. These are where we don't have coverage on this plan. But when I talked about ancillary products, we can add a very inexpensive cancer plan for you, again, through Colonial Life. Colonoscopies, guys, I got deals on colonoscopies that are better than paying for it through your insurance, because one way or another, you're going to pay for it, right? So you either pay for it in premium or you learn how to shop the market. So if you need a colonoscopy, we got ways to deal with that, for the one time you got to have it every 5 years. Okay. So let's not pay insurance for, over the whole year of something you may not ever use. Again, we can add that in when you need it, if you ever need it. And again, any of these additional pieces are normally, hospice care is not normally covered under major medical under 65. Oh, by the way, I do need to emphasize this. This is for 65 and under. It does not qualify for Medicare. So you need to continue on with Medicare if you are on that, if you are 65 and older. All right, so now I'm going to talk a little bit about dental. There is a basic Delta plan that all this covers is your preventative. Okay, so it's going to cover exams, your x-rays, your cleaning twice a year, etc. But that's all it does. And so that's $30 a month. And this Delta Dental is a nationwide Delta Dental. It's Delta Dental of New Jersey. However, that means it's nationwide, and you can use it in network as a Delta Dental patient across the country. So for instance, let's say you're traveling to High Point and you're from California and you break a tooth. Oh crap, I need to be able to go to the dentist. This is preventative. That one's not going to help. But this next plan, also from Delta, is comprehensive. So again, no matter where you're traveling, if you're traveling out to, you're anywhere in your region, you need to be able to, if I got to go, if I have an emergency dental issue, I need to be able to go, and I want to go in network so I don't have to pay extra. So again, you have Delta Dental across the country, no matter where you travel. And as you can see, this is still going to pay 100% of your preventative. But if you have like that special dentist that doesn't like insurance at all, it's still going to pay. Guess what? It's still going to pay, but it's only going to pay 80%. And then as you can see, there's in and out of network benefits on these plans. Like I said, it is Delta Dental, and you can see how these work. And as you can see, your deductible is $50 or $150 for the family. Out of network, $100 and $300. And your preventative and diagnostic does not go towards your deductible. Here's the other thing, guys. Because this is a group plan, okay, even though you're buying it as an individual, because this is a group plan, you have no waiting periods. Okay, so if you bought an individual Delta product on your own, you would have 12-month waiting period for major services to be covered at a decent rate. So, and that's the same with most of the dental products out there if you're buying it on an individual. So again, this is as if you're an employee and you get group pricing. So that means the day you're effective is you're golden with no waiting periods. The other thing, and this to me is huge, if you don't use your insurance for anything other than preventative care, and you still have that $1,500 use, you can carry that over. Now you can only use part of it, and there are specific exclusions, and we can go over that if we talk through further. However, there is a carryover of value not used. So you can build up a bank, say for instance, you know that you're going to have, you know, you want to have some major work done and you need to build up that bank. Well, you can build up that bank and it's going to be there for you when you need to use it. So you're not just all use it or lose it. VSP, the largest vision provider insurance in the country. So I think it's 3 out of 4 optometrists take VSP. So that's who we went with. It is VSP PPO, which is the same. Oh, by the way, Delta Dental is also a PPO. All of this is PPO. There is no referrals needed on anything. So you don't have to worry about, I have to get a referral so I can go see a specialist. No, not on this plan. Again, I tried to make it as easy as possible for you guys because I really wanted this to work for you and to be, you know, a good function for you. Now, as you can see, this is going to be, you know, copay based. And if you go to Walmart or Sam's, Costco, just to get your glasses and frames, you're going to save a whole bunch of money. You don't have to, but if you do, you get a whole lot of money saved. And then again, you get additional coverage again for out of network. I really wanted to make sure that when we made these plans and we designed them for you, that you weren't forced to go one place or another. And so from a health perspective, your health is, if you were calling your doctor to say, hey, you know, when you call your doctor, what are the first 2 things they ask? What's your name? What's your date of birth? Oh, what's your insurance? So although this is called OptiMed, it's called an OptiMed day plan on all of this, and Delta and VSP. I'm so sorry, excuse me. Because they are called these kind of plans, we can put pieces together with them. And at the same time, we don't get stuck. But when you're calling that doctor and they ask you the question, you're not going to say OptiMed. You're going to say PHCS because that's the PPO network. PHCS stands for Private Healthcare Systems. So all of these private carriers that are not Blue Cross, Cigna, Aetna, Humana, and I missed one, United Healthcare. They're called the BUCAs. There's 5 of them. And they're the ones who obviously have the big buying power. So anytime you've ever gone to the doctor or the hospital and it says, you know, here's what your charge is. Oh, insurance discount or insurance price. And then here's your price. That's because there's a retail and then there's a wholesale, believe it or not. And every wholesale department is going to be different. And I think that's the easiest way to say that. So when you go out of network, you may not still get wholesale prices. So again, if we stay in network, that's when you're going to get the best. So calling your doctor to see if they take it. Do they take PHCS? Would be your doctor, private healthcare systems. It is the largest generic PPO in the country, meaning they have the most buying power. They actually have more buying power than Blue Cross, believe it or not. So that allows us to, you know, maximize, you know, your benefits at the same time. So, you know, in or out of network, though, you're not stuck. From a hospitalization standpoint, it's called open access. What does that mean? That means you can go to any hospital you want to for anything. And that's the one thing I really liked about the program is that we left hospitals off. So you didn't have to worry about, well, do I have to go to this hospital or the one across the street? Especially for you guys that live in the triad. Oh my gosh, I was like trying to find the right place and that was insane. And then this comes automatically with your card. There are some savings. I don't know if any of you have priced hearing aids recently, but good God have mercy, they're so expensive. I was looking at them for my husband. I'm like, he can just be deaf. I'll turn up the TV. And but it does have some additional discounts. But if you're diabetic, there's a big time diabetic program. Again, yes, if you're a diabetic, we can have this plan. So there's some additional pieces. Now the Met card is a discount plan. Okay, this piece alone is a discount plan. There's not insurance involved in it. However, it just comes along with your program. Preventative services, and guys, we can get you this. This will be this brochure we can send out to you, and we'll send it to anybody on the call. But this just tells you the preventative care. It's anything that your preventative care plan covers now. It's the same things. By law, to be compliant with the ACA, it has to cover all preventative services. So for this particular plan, it's going to cover all preventative services. So in summary, we have our health plan, we have our vision plan through VSP, and we have our dental plan through Delta Dental. All guaranteed issue, no waiting periods other than getting enrolled timely. And And, you know, and that's it. So we can get going immediately. Again, here's the links specifically for your page. You can always get to your own applications specifically for you by going to my own website. My name is Tish Zitzow. You can go to tishzitzow.com/IHFRA. You have your own portal to be able to reach out to me. You can fill out an application, and we can look that application link that's up there right now with my name. That allows us to go ahead and see, is this the best plan? Is there something less expensive? Because IHFRA has been very, very specific that we want to do what's best for you, whether you choose the association plan or not. So what we can do, and you can get that application filled out. We'll look and see what's best for you guys, and then we'll send you something in writing to explain to you, okay, here's what IHFRA's plan looks like. And there might be something else, and here's another plan, or there might not be, depending on your health or where you're located, because in a lot of states, a lot of plans aren't available. But this is all 50 states because it's a nationwide PPO. So that kind of sums it up for me. I am going to stop sharing. And what I'm going to do now is I'm going to open it up. I'm going to unmute everybody and give you guys the opportunity to ask any questions, anything else like that. Hold on, I'm gonna, okay, you are all allowed to unmute yourselves. Any questions for anyone? Oh, well, okay, I'm not getting any questions. The box is empty. Steve did put the link to the Colonial Life into the chat box. So if you want to see that, I'm going to end recording here, and I'm going to thank you for your time. If you guys have any questions, you reach me this way, and I am happy to assist you however we can. Again, whether we find that this is the right plan for you or we need to find something else. I appreciate your time today, and I hope you all have a fantastic week. And you're welcome, Bonnie and Steve. I appreciate you guys allowing me to do this, and I hope you all have a fantastic week. Thank you, everybody.